Hey guys, welcome back to the course. In this session, we're going to give you an introduction to suturing. So we're going to start off by talking about what suturing is and why it's important. We're then going to talk about how you would go about preparing a wound before you start suturing. And then we're going to finish by talking a little bit about the different types of suture before showing you a demonstration of how to do a couple of different types of suture. We're going to cover how to do a simple interrupted suture and also a continuous suture. Don't worry if you don't know what those mean at the moment, it will all become clear later on in the video. So let's jump into it. So suturing is essentially just the medical term for stitching a wound back together, and a suture is just a piece of material or strand of material used to approximate the edges of a wound together. Suturing is important in lots of areas of medicine, but the most common reasons you might want to suture would be firstly in an operation, so any kind of surgery, you need to close up the wound and close it back together, so suturing is always really important there, and also in A&E or the emergency department, when patients come in with injuries or cuts or lacerations, those also need to be sutured back together at times. So those are two really common applications. So the first question to ask is, why do we actually need to suture? And there are a lot of different reasons for this. The first and one of the most important reasons is to actually help a wound to heal. Now, your body has a natural healing process and all wounds will eventually heal naturally, but sometimes this can take a very long time, particularly if the wound is in a very awkward location, or sometimes if the wound is very big and the edges don't approximate by themselves very nicely. Again, that will mean it takes a very long time to heal. So by suturing, what we actually do is we bring the edges of the wound together, and this encourages them to heal through a process called primary intention. So primary intention is just this idea that you bring the two edges of the wound together, and that encourages the body's sort of natural healing process. So by suturing, we can actually speed up healing quite a lot. The second really important reason for suturing is to reduce the risk of infection. So obviously any wound that's open and exposed to its surroundings, there's always a risk of bacteria or other kind of microorganisms finding their way into the wound and causing an infection. So we want to reduce that risk, and we can do so by closing up the wound sooner rather than later. The wound is therefore exposed for a smaller amount of time and the risk of infection is less. Another really important reason for suturing is to improve the cosmetic result and reduce the amount of scarring. So scarring is unfortunately an inevitable consequence of any wound healing, because the body's natural healing process involves deposition of lots of these proteins which cause formation of scar tissue, and which is what you see for any scar and looks a little bit sort of unsightly. Scarring is sort of more common in certain types of wound and also in certain skin types, so individual patients, but we can suture and help to reduce the amount of scarring by bringing the edges together and encouraging healing by primary intention, as I explained earlier. You can often reduce the amount of scarring that occurs. So this is especially important for kind of wounds or lacerations in areas which are very kind of visible and exposed, such as on the face. Other reasons for suturing would include to reduce the amount of pain, because open wounds are always more painful than wounds that have been closed, and also to reduce the amount of bleeding, because again, wounds can bleed a lot. So as I've said, there are lots and lots of reasons to suture. So now let's talk a little bit about how we would prepare our wound before we actually start suturing. The first thing we want to do here is actually inspect the wound and have a really good look. Now, this doesn't really apply so much to when you're suturing in a surgery, because you obviously already looked well inside the body, but in the case of sort of an emergency department scenario where you've got a patient who's come in with an injury, it's really important to inspect the wound there. You want to make sure that the wound is sort of clean from inside, that there's no dirt there, and more importantly, you want to make sure that there's no shards of glass, for example, or remains of whatever's caused the injury. Because if you suture a wound and leave those things inside, it's not going to heal very well, and it's also going to cause an infection, which can make this patient seriously unwell, and you'd also have to go back, open the wound up again and take those out. So you really want to avoid that situation if possible. If you have doubts about whether there might be some small pieces of glass in there, for example, you can send the patient for an x-ray, because an x-ray will pick up glass and show it very clearly, and is sort of much more sensitive than the human eye for kind of picking up stuff like that. So often we do end up x-raying wounds before we actually stitch them up. After having inspected the wound, our next step is to then clean the wound. Now, normally we clean the wound quite sort of thoroughly with an antiseptic wash, such as sort of chlorhexidine, betadine or iodine. So these are all very strong antiseptics that we use in hospital. And we apply it generously around the wound and to the wound itself. The idea of this is to reduce the risk of us introducing infection into the wound. So remember before I talked about one of the main reasons for suturing being to reduce the risk of infection. Well, the flip side of that is that by actually suturing and, inserting instruments into the body, there is a risk of us introducing infection. And we need to make sure to minimize that because, we're kind of defeating the whole point here if in the process of trying to reduce infection and benefit the patient, we're actually making them worse. So cleaning the wound and having good what we call aseptic technique. So by that I mean being clean in terms of your procedure. So being clean is really, really important, and we really want to avoid introducing any infection into the wound. After we've cleaned the wound, we can then kind of set up our equipment. So sutures normally come in a little pack that contains all of your instruments, which I'm going to show you later. But you normally open the pack very precisely. So you want to only touch the outsides of the pack because what's inside of it is sterile. So you fold it out very carefully and making sure not to touch the inside. And after it's folded out and you've kind of washed your hands thoroughly and your arms, you put on sterile gloves. So these are gloves that have been completely sterilized. And at that point, you then kind of start your procedure. And you have what you call a sterile field, which consists of that kind of suture pack that you've opened out and also the wound. And during the procedure, you're only allowed to touch what's in that sterile field, so the instruments and the wound. If you touch something else during that time, your sterile field is broken and you need to start again. So it's really important to kind of be mindful of what you're doing and make sure you're not touching anything that's kind of not sterilized that you're not supposed to. The other thing you can also do at this point is inject the patient with some local anesthetic. So if it's a very big wound or if it's in a very sensitive area, you can give them some local anesthetic to kind of numb the area and kind of reduce the pain from the needle going in and out and actually suturing. So that's kind of our process of preparing the wound. Now let's talk a little bit about the different types of suture. So broadly speaking, we can divide our types of suture into absorbable and non-absorbable sutures. Now, absorbable sutures, as the name suggests, are naturally absorbed by the body. So when you put these sutures into place, after a few days or a couple of weeks, depending on the type of absorbable suture, the body will kind of absorb that back up. So once you put them in, you don't really need to worry about it. With a non-absorbable suture, the body doesn't break these down naturally. So when you put these in, you need to remember to take them out again in a couple of weeks' time. If you don't do that, they kind of become embedded in the skin and you get sort of a very nasty looking scar afterwards, which often then becomes infected because you've got that foreign suture material kind of embedded in there. So it's really important to remember to take out your non-absorbable sutures. Obviously, you can only use non-absorbable sutures in the skin. You can't use them in the body because then you would not be able to get them out. You need to open them up again and you're kind of defeating the whole point. So absorbable sutures can be used inside the body and in the skin, but non-absorbable sutures can only be used for the skin. So that's a bit of information about kind of suturing, why it's important, the types of suture, and kind of how you'd prepare a wound. Now we're going to give you guys a demonstration of how to do two common types of suture. The first one of these is a simple interrupted suture. The simple interrupted suture, as the name suggests, is lots of individual sutures which you tie separately, so there's an interruption between each one. The advantage of this is that you get a really good seal, and if one suture is slightly loose, it doesn't really matter because the others are still holding the wound together. The disadvantage here is that it takes a lot of time to do because you have to kind of tie and cut each suture individually before moving on to the next one. The other type of suture that we're going to show you is the continuous suture, and this one is much quicker to do, as you'll see in the video, because you kind of do a continuous loop before tying it off right at the end. The drawback here is that if part of the wound or this part of the suture becomes undone, you end up with the whole wound unraveling. So, there are pros and cons to both, but in any case, we're going to show you how to do each one, and it's kind of personal preference what you want to go with when you're practicing. You'll notice in the video that I'm using a suture pad. If you have one of these, then great, but if not, don't worry. In the first part of the video, I'll show you how to kind of substitute a suture pad for a kitchen sponge and kind of how to cut it and make a wound for yourself. I would recommend practicing on either a suture pad or a sponge as a starting point, because later on in the video, we show you how to do suturing on a banana, which is a bit more challenging, but I would recommend trying to get the basics down on either the suture pad or the sponge beforehand. So hopefully that's all clear. Here's the video, enjoy. So before we actually get started and I show you the instruments, I just want to show you guys how to prepare your own equipment. So I've got a suture pad here. If you've got one of these, then that's great. You just cut an incision for your wound in there. If you don't have one, that's absolutely fine. You can just use a normal kitchen sponge like so. And with this, all you do is you grab a pair of scissors. I mean, I'm using the suturing scissors here, but any pair of scissors is fine. And you literally cut like so. Okay, and you've got a nice wound, and all you want to do at the end is sort of put your fingers or thumbs inside and just pull it apart a little bit more so you have a wider wound. And now you'll actually have to use sutures to bring the edges back together, but normally it sits sort of a little bit wider like that. You can even widen up a little bit more. Okay, so if you don't have a suturing pad, a sponge is a good starting point. We're going to show you how to do it on a banana later, but that's a little bit more challenging. So I would recommend that you try it on something like a sponge first, because this makes it a little bit easier to learn. So let's start by going through the equipment we're going to be using during suturing. So to start with, we have our needle holder. Now this looks a little bit like a pair of scissors, but it's actually used to hold your suturing needle. So at the top, you've got these jaws, which are used to hold the actual needle of the suture and lock it in place. And at the bottom, you've got the clamp, which locks, and some handles. Now you hold these handles with your thumb and ring finger in your dominant hand. So your right hand if you're right-handed, or your left hand if you're left-handed. Now, what happens is the needle is inserted into the jaws, as I mentioned, and then this locking mechanism can be used to lock that in place, and after that it won't open. The way you open and close this is by pushing your fingers apart. So not only in this direction, but also in this direction. So like so. If you can see what I'm doing there, that's the locking and unlocking mechanism of the needle holder. We're going to come back to this later, and it will be clearer when we're actually locking the needle in place. The next set of equipment to touch on is this pair of Adson forceps. So these forceps, if you look, have very fine little sort of corrugated edges, and these are used for holding tissue in place when you're passing your suture. Okay, and it's quite self-explanatory. You just squeeze to grip and relax to let go. The other pair of forceps here are what we call these toothed forceps. So as you can see, instead of having that fine corrugated edge, we have sort of these two big sharp teeth at the end. Now these are quite good for holding tissue in place, but we have to be careful with these because the teeth can be quite destructive to tissue at times. So most of the time we tend to use our Adson forceps with the corrugated edges rather than the toothed forceps. So I'm going to keep these aside, and the ones I'll be using during the video will be these Adson forceps. The last thing we've got is this pair of iris scissors. So these are literally just scissors, and we use them to cut each suture after we're done, which will all become apparent a little bit later. Okay, so that's all of our equipment. Obviously we've got the wound in the middle. So now let's get down to actually suturing. So this is our suture, okay. As you can see, it tells you a lot of information about the suture on there. So nylon is the material this is made of, so this is a non-absorbable suture, as you can see here. And the 40 is the size of the suture. So in general, the higher the number, the smaller the suture. So 40 is actually a fairly small suture, and by small, that means that the string is quite thin. So let's open it up. And when we open a suture, in real life, this would all be a sterile area around the wound. So I want to open it by touching the packet and then just letting it drop into my sterile field. Now here's the suture, okay? Now this one is one I actually have to tear open as well. Okay, so you can see that, and then I pull out this, and you can see as I unfold this, you can then see the needle appear. And the needle is a curved sort of semicircular shape, and it'll become very apparent why, because that shape is very helpful for helping us to pass the suture through the wound. So what we want to do is grab the suture with the needle holder and pull it all the way out so the string all comes loose out of the packet. Okay, so as you can see, we've got the whole suture there. I can put this aside, that's just rubbish now. Okay, now what I want to do ideally is avoid touching the actual needle itself. Now obviously everything is sterile, so it doesn't matter too much from a cleanliness point of view, but this is to avoid what we call needle stick injuries. So if this needle has already been inside the patient, and then you cut yourself with the same needle, you're at risk of catching any sort of blood transmitted diseases from that patient, so things such as hepatitis and HIV. Now, the risk of transmission, especially if the diseases in the patient are well controlled, are quite low, but it's still better to be sort of as safe as possible. So what you really want to do is avoid touching it as much as possible, because if you do get a needle stick injury, you then need to go and stop what you're doing, go and wash your finger for a few minutes, and then have some blood tests done just to make sure you haven't picked up anything from the patient. So if at all possible, try and avoid holding the needle. As a starting point, because we're just practicing, and we're not used to it at the moment, we can touch it for now, and obviously this isn't a real patient either. But for real life, try and avoid touching the needle as much as possible. Now, if you look, this is the way to grip the needle, okay? If you can see, it's perpendicular to the needle holder, so the needle holder is going in this direction and the needle is pointing downwards. And you want to hold it sort of about 2/3 of the way up, okay? And it needs to be perpendicular, and once you're happy, you lock the needle holder in place like so, okay? And once it's locked, you'll see if you try and budge the needle, it won't bulge. If I unlock it, you can see the needle, if it's sort of, there's a pressure applied, it will move like so, which is what we don't want to happen when we're actually passing the needle through the wound. And that's why it's so important to lock it in place. So we want it to be locked like so. So as I said, perpendicular and about 2/3 of the way up, and then lock it in place. Okay. Now, before we actually pass the suture through the wound, it's a good idea to practice the motion we're going to use. Now, if you look, the curvature of the needle is like so. So when I'm passing the needle, I'm going to use the curvature of the needle and just pass it by moving my wrist like so. And that gives a natural semicircular motion, which lets you take a nice clean bite out of the wound. So let's have a go on the wound itself. We're going to start from the middle of the wound, okay? Now what we want to do is go in about 1/2 centimeter away, so around there, and come out the same distance away from the other side. So like we said, we're using our semicircular motion, okay? And we're going to do it in one bite like so. Okay, and as you can see, I'm using the forceps to pull this out on the other side. Okay, and I want to pull this most of the way through. Okay, so as you can see, I'm pulling this now. And you keep pulling, and you keep pulling, keep pulling, and you want maybe sort of 3 or 4 centimeters left on the other side, okay? And as you can see, I've been holding my needle with the needle holder on the other side. Now I've passed it through and I'm coming up, you know, roughly the same distance from either side. I can put my needle down and I can put my forceps down, okay? And now all I need is my fingers to hold the string and my needle holder to tie the suture, okay? Now what I'm going to do is this needle holder is going to go in the middle like so, and I'm going to use my left hand to wind this round the needle holder like so, okay? So that was one loop, a second loop, and a third loop, okay? And then I'm going to grab that loose end, okay? And then I'm going to pull these in opposite directions, like so, okay? And once I've pulled that and it's nice and tight, you can see the wound is closing. I'm going to move this to the opposite side and lock it in place, okay? So that's the first knot of our simple interrupted suture. the second knot is now going to be going in the opposite direction. So remember in the first knot, I was doing loops in this direction, so like, oops, like this, okay? The second knot I'm going to do in the opposite direction. So I'm going to wind this like so. Okay, and you want to, so I made the mistake there of not moving everything out the way, so you want the needle actually out of the way. So needle holder in the middle, wind that round like so. So remember, I'm coming towards myself, and then grab the loose end, pull through. Okay, so that's the second knot, and now we do a third and final knot. So remember, we went away from ourselves, then towards ourselves, and now we're going to do away from ourselves again. So let's wind this round. So we're going one loop away from ourselves, grab the loose end, and pull through. Okay, and as you can see, that's quite a neat suture. The wound's closed quite nicely. You don't want to do it too tight because then the wound sort of becomes crumpled up. So you want enough tension in the suture to close the wound, but not so much that it will start to deform it. And once we're happy with it, we can put our needle holders down, and this is where our scissors come in. We just give it a little cut. So we can cut maybe and leave 1/2 centimeter, like so, and we can also cut the other loose end about the same length. Okay, and then we've got our suture in place. So that's your simple interrupted suture. Just to summarize what I've done, we went in with the bite using the semicircular motion and came out the same distance from the other side. And then we used our suture tie. So we went 3 loops away from ourselves, tied, 1 loop towards ourselves, tied, and then 1 loop away from ourselves and then tied it off. Okay, so I'm going to show you again, just so it's consolidated and you understand what we're talking about. So remember, I'm gripping the needle 2/3 of the way up and it's perpendicular, and I'm locking it in place with the needle holder. Now I'm going to go in about 1/2 centimeter away from the wound. I've got my forceps in my other hand just to guide what I'm doing, and I'm going to use this motion, remember, with my wrist. Okay, so I'm going to go in there, nice semicircular motion, and come out the same point on the other side. I'm using my suture and my forceps in my left hand to pull this through. Okay, I can grab this with the needle holder now, transfer, put the forceps down, and now I'm going to pull this all the way through. Okay, and I want to leave, as I said, maybe sort of 3 or 4 centimeters, okay, because you don't want to leave too much here, because whatever is left here essentially gets wasted because you end up cutting it off later. So now back to our suture tie. So all we need now is our left hand or non-dominant hand with nothing in it, and your dominant hand with the needle holder in it. And you put the needle holder across the wound, okay, and we're going to do let's try that again. We're going to do 1, 2, 3 loops away from ourselves, then grab the loose end and then pull through. Okay, and my left hand is going away from myself and my right hand is coming towards me. Okay, and once I've done that, I'm going to lock it by moving this up away from myself. So let's tighten that and then lock it, and once it's locked it won't budge as easily. Okay, so that was 1, 2, 3 loops away. Now I'm going to do a single loop towards myself. So I'm going to put this like so, and we're going to go 1 loop round, grab the loose end, then tie it off. Okay, and then final loop, so we're going to go 1 loop away from ourselves, grab the loose end, tie it off. Okay, and again we've got a fairly nice sort of tight suture, but nothing too tight. Okay, so we've done 3, 1, 1. Okay, and now we're going to cut it again. So like so, and like so. Okay, and let's do another one just to make sure we've got it. So like I said, so as I said, ideally you wouldn't hold the needle, but because I'm showing you guys and this isn't a real patient, we can touch the needle. So you want to hold this perpendicular about sort of 2/3 of the way up. Okay, you're going to use your clamp to lock it in place, and we're going to go in sort of about 1/2 centimetre away. We're going to use our forceps, and we're going to use a nice sort of curving motion of our wrist to guide that through. Grab it from the other side and pull through. And remember, we leave 3 or 4 centimetres on the other side. We can put our forceps down now. Now we can put our needle down, and all we need is the needle holder. So remember, we want to do 1, 2, oops, let's try that again. 1, 2, 3 loops away from ourselves, grab the loose end, and then pull through and lock. Okay, now we're going to go towards ourselves. So 1 loop like so, grab that, pull through, and we'll do with the final 1 loop away from ourselves. So 1 loop like so, grab the loose end and pull through. Okay, and again we've got quite nice tidy suture there. So let's cut this now. So cut there and cut there. Okay, so that's how you do a simple interrupted suture. Okay, so each suture is tied off and cut before you go on to the next one. Just to recap what we've done, we've gone in with this curving motion and come out. Okay, and remember to use your wrist when you do that. You don't want to be using your fingers in your hand, because then you won't end up with a nice even stroke. Once you come out, you pull it through, leave about 3 or 4 centimetres at the end. Then we do 1, 2, 3 loops away from ourselves, grab the loose end, pull through. We then do 1 loop towards ourselves, grab the loose end, pull through, and then 1 loop away from ourselves, grab the loose end, pull through, and then cut the suture. Okay, hopefully that's enough for you guys to have got it. If you need to re-watch it or pause, or give it a go yourselves, pause the video now. Otherwise, we're now going to move on to how to do a continuous suture. Okay, so that was the simple interrupted suture. Hopefully you guys all managed to follow that and managed to practice along. If you need to pause the video, of course do it, and go back and watch anything you need to. But otherwise, we're going to now move on to the continuous suture. The second suture that we're going to learn today is a continuous suture. So this is the same wound that I had before. I've removed the simple interrupted sutures, and now I'm going to suture it with a continuous suture. So I've got the same suture that I was using before. So this is the 2-0 nylon, and this is the same needle holder, and I'm going to grip it in exactly the same way. So I want to hold it 2/3 of the way up and perpendicular to the needle holder, and lock it in place like so. And I'm going to go in towards one edge of the wound this time, so rather than from the middle, and I'm going to work my way along. The reason why I do that will become apparent very quickly. So I'm going to use the same sort of curving motion of my wrist to do the suture, to do the initial bite of the suture. So I'm going to go in 1/2 centimetre away, do this nice curving motion, come out similar distance on the other side, and grab it with my forceps. Okay, and I'm going to pull it through and give myself about 3 or 4 centimetres on the other side. So I've left myself that 3 or 4 centimetres, and the first part of the suture is actually exactly the same as the simple interrupted suture. So I'm going to put my needle holder in the middle. I'm going to go around once, twice, 3 times away from myself. I'm going to grab the loose end, and I'm going to pull through. Okay, and once I've tightened it, I'm going to lock it on the other side like I did before. Now that's the first 3 away. Now I'm going to do 1 loop towards me, grab that, and pull through. And finally, I'm going to do 1 loop away from myself, grab the loose end, and pull through. So remember, 3, 1, 1. Okay, so now I've got this first suture in place. If I was doing a simple interrupted suture, I would now be cutting this. But because it's a continuous suture, I'm going to leave this in place, and I'm not going to cut anything right until the end. So I'm now going to get my needle again, I'm going to again hold it 2/3 of the way down, like so, and lock it in place. And I'm going to go in about 1 centimetre away, because this is where you need to decide the spacing of your separate knots, and I think about 1 centimetre here will be fine. And I'm going to go in 1/2 centimetre away, do that same curving, and come out, and I'm going to use my forceps to help me grab the needle. Okay, pull it out, and then I'm going to pull through. And as you can see, the suture is now all connected. Okay, now I've come out here, I'm actually not going to tie it again. I'm going to grab my needle again. Okay, so again, 2/3 of the way down, perpendicular, and then I'm going to go another centimetre along, and I want to keep the same distance. So go in, do a nice sort of curved motion. And pull through. And now you'll see you start to get these diagonal lines appearing, which is what your continuous suture will traditionally look like. Okay, so again I'm going to do the next knot now, so I'm getting the same needle, grab it again, and this time I'm going to go again about 1 centimetre away. Going to come out same distance on the bottom, grab it, and pull through. Now we've come out here, we're now going to go in and do the same loop again. So let's find a point. Okay, we want to give about 1 centimetre, go in about 1/2 centimetre away from the wound, do a nice curve, and come out like so. Okay, same again. Okay, so we're going to grab our needle about 2/3 of the way up, grab it like so. Okay, we're going to go about 1 centimetre along, 1/2 centimetre away from the wound is where we're going to go in. Let's do a nice curve, come out here, okay, same again. Okay, so just make sure we get our spacing right. Okay, now let's do one more. Okay. And we'll come out. Oop, that's wrapped around the pad. Pull that through. Okay, so now we can keep going, but let's tie it off here. Okay, so the tying off procedure is what's just a little bit different, but it's effectively the same thing. Just imagine that this is your end with the needle and that's your loose end. Okay, so I'm going to just give myself a little bit of slack here because I'm going to need to use this to tie off later. Okay, and so I've just raised that loop a little bit, and now I'm going to do the same thing. So I'm going to go 1, 2, 3 loops away from myself, and instead of grabbing a loose end, I'm going to grab this loop, and I'm going to pull it tight, like so. Okay, and instead of that end, you can see you have a loop there. Okay, so remember that was away from myself the first time, so now I'm going to do 1 loop towards me, grab the loop, and pull tight, and then 1 away from me, grab the loop, and pull tight. Okay, now we've tied it off the start and at the end, and now all we need to do is cut the suture. Okay, so we're going to cut it here, and we're also going to cut this loop there, and we can also cut it at the start, there, and there. Okay, and now we've got our continuous suture like so. Okay, now you can keep going right to the end of the wound. This was just a slightly shortened, but I would just keep doing loops like so. Alright, so that's your continuous suture. Advantages of this, as I said before, are that it's quicker. So we did lots of loops in consecutive sort of fashion without having to tie it off. We only have to tie it off at the start and at the end. The disadvantage is that when you break it or cut it, the whole thing. So if this became unraveled, for example, if I cut this here, you'll see that the whole thing sort of now comes apart. And that's the disadvantage of a continuous suture. But as long as you do it well, that shouldn't happen. Okay, so that was the continuous suture. Again, hopefully you guys managed to follow that or practice along. If you haven't, please feel free to pause the video and go back. But now we're going to move on to sort of more of a challenging endeavour, which is suturing the banana. So here is my attempt at a banana reconstruction. Hi guys, welcome back. Now we're going to learn how to basically level up a little bit and suture a banana. So this is one I prepared earlier. As you can see, I've kind of cut it along here. The difference is don't peel it normally, because then you'll end up with lots of kind of little leaflets. You just want one cut. So the best way is either to puncture it with sort of a knife or scissor, or just kind of bring it apart with your hands. So you just have one kind of cut down the middle. And our aim is going to be to sort of suture this back together and reconstruct the banana. So just before we start, what I would say is that make sure you've practiced either on a suture pad, so like I had earlier, or on a sponge, like I showed you guys how to cut before as well. Just because those are a little bit easier, so when you're first learning how to do the suture, how to kind of hold the needle holder and all your knots and so on, it's much easier to do it on one of those. The banana is a lot more delicate, so it is more challenging, and it's better to know what you're doing a little bit before you try this. But yeah, that's all. Let's get started. I've got a suture here which I opened earlier, so this is again another nylon suture. We're going to hold the needle holder, so the needle exactly the same way as we have been. And we're going to start from the middle, okay? And I'm going to go a little bit further away from the kind of edge of the wound than I have been previously, and this is because the skin of the banana is quite delicate, okay? So I don't want to cause any tears, okay? So I do that. I will come out from the middle, and now we'll pull it through, like so. And I'm going to leave myself a few centimeters on the end, okay? So let's leave just that much, okay? And now we're going to do our knots like we did before. So I'm going to put my needle holder in the middle, okay? I'm going to wrap around once, twice, 3 times. I'm going to grab this, then we're going to pull it tight, and as you can see, the wound is now closing up from there, so that's good news. Okay, so I'm going to put that down for a sec just to kind of take this little tangle out. It's just got a bit trapped, so all you need to do is just pull that through like so. Okay, and once you've done that, lock it on the other side. Okay, and now let's go again. So we've gone away from ourselves, now we're coming towards ourselves. Grab this and pull it tight, like so. And third knot, so one loop, grab the loose end, pull tight. Okay, so now we've got our first suture of the banana. Now let's cut it. So we get our scissors, cut from there, cut from there. Okay, so first suture now done. So let's put another couple in now. Okay, so it's nice to work from the middle and then kind of work your way outwards so you get some sort of nice even closure. So let's get our needle again. Okay, grab our needle holder and we want to grab it the same way we did before. Okay, now let's go in around about here. So as you can see now, the banana is starting to close up nicely. It's still coming apart a little bit here and a little bit there. So let's put a suture here and a suture here. Okay, and now we said we were going to put one there. So let's do that. And you can see it's just sunk in a little bit, so let's just bring that back up just to make sure one's not overlapping the other before we tie it. And as you can see, this half of the banana now is sort of reconstructed quite nicely. You can see the wounds all come apart. We now need to put this one together, so let's do a continuous suture here. So my suture here isn't very long now, so I'm going to get another one. So here is one I opened earlier, so let's use this. Okay, so this is another nylon, it's a thicker suture, so this is a 2-0. So what I'm going to do is start at the end and then work my way along. Okay, so let's start here. Okay, give ourselves plenty of room. Nice bite. Just realised there's a knot in here from earlier, so let's get rid of that. Okay, so we're first going to tie effectively what's just a normal sort of simple interrupted suture. So let's do that. Okay, so we've done the first loop and locked it, one towards ourselves. Okay, and then one away from ourselves. Okay, so remember that's our first knot. We're not going to cut this now. And now what we're going to do is we are going to keep doing more bites and not tie it off until the end. So let's go in about here. Okay, pull that through. Grab our needle again. Now we're going to go about here. And again, pull it through. One thing you do want to be careful of with the banana is that you don't end up with one edge going under the other, so just keep an eye on that. Okay, but now you can start to see your continuous suture forming here.
Okay, so let's grab our needle again. Just go in here. Probably need a couple more still. Now we're going to tie it off. Okay, so remember we're using the loop to tie it off. Okay, let's just make sure the edge is nicely approximated. Okay, so we're going to go 1, 2, 3, grab the loop, untie, then we're going to go once towards ourselves, grab the loop, and pull, and finally once away, grab the loop and pull, and now that continuous suture is tied off. So now finally we can cut it. So let's grab our scissors. Okay, and we can cut the loop, and we can also cut the starting suture as well. And as you can see, this banana is now put back together. We've got some simple interrupted sutures here and a continuous suture here. Okay, so that's a little tutorial on how to suture together a banana. Hopefully you guys can have a go. You can probably do a better job than I have, hopefully. The skin's sort of a little bit submerged there. But that's the principle of how you want to be doing it.
Okay, so that was my example of a banana reconstruction. It wasn't too bad in the end. I'm sure you guys can probably do better. Kind of my edge on one end wasn't perfect at all. So yeah, go away and have a go at reconstructing your bananas, and definitely send us in pictures. We definitely love to see them. Otherwise, I think that's kind of brought us to the end of the video. Hopefully it's been useful. You've learned a little bit about the different types of suture, how to prepare your wound. And also, you know, you're kind of more confident now in terms of doing your simple interrupted and continuous sutures. Fingers crossed you've also all managed to reconstruct some bananas now. As always, if you guys have any questions at all, please do send them in to us and we'll get them answered. But otherwise, that's the end of the video. Hopefully see you guys soon.